Good afternoon, everyone. I'm James Crummell. Early this year, we told you how lots of Pennsylvanians were dropping their health coverage because of soaring premiums. Well, it turns out that wasn't even the whole story. Seth Kaplan live in the ABC 27 newsroom with what has happened since then. Good afternoon, Seth.
Good afternoon to you, James. Yeah, it was one thing to sign up for coverage this year, despite the soaring Affordable Care Act premiums. It's another thing entirely to actually be able to pay those premiums each month. Leaders at Penny, Pennsylvania's insurance marketplace, warned us at the beginning of the year not to be surprised if a lot of people lost coverage during the year because they couldn't afford to make the monthly payments. Well, the Wall Street Journal reported this morning that across America, about 1 in 7 Americans who signed up for the Affordable Care Act coverage this year didn't even manage to pay their January premiums, let alone those in months after that. We wondered what the situation is in Pennsylvania, checked with Penny. They actually pointed us to very current data, updated just through last week. And the part we already knew is that after more than a decade of increasing enrollment, 85,000 Pennsylvanians dropped coverage during open enrollment this year. What we now know is another 45,000 Pennsylvanians have lost coverage since then because they have missed monthly premium payments. Across the state, premiums doubled on average, but they nearly quintupled in Juniata County. That 485% increase you see there was the highest in Pennsylvania. 37% of people in Mifflin County lost their coverage. Mifflin tied in that dubious regard with Schuylkill County for highest in the state. All this after enhanced premium tax credits, as they were called, ended this year. Congressional Democrats wanted to keep them. The Republican majorities in the U.S. House and Senate wanted to let them expire. James, those were COVID-era subsidies that lowered premiums for a lot of Americans the past few years, which led to a record percentage of Americans having health insurance. By last year, that trend has now reversed.
Seth, it's pretty incredible watching you go through those numbers. I mean, I think I saw 485% on one of them that the premiums have gone up. It's just an incredible number to see. And then, you know, on top of that, you have the economy and you have gas prices, you have everything else. So you can see people probably have not been trying to pick and choose what they're going to pay for.
Exactly. And there are no good choices. Yeah, it was 485% increase in Juniata County, which was the highest in the. So let's say if somebody had a $300 premium last year on average in Juniata County, that went to, you know, upwards of $1,400. On average across the state doubled. And so, and by the way, I looked also, and we're going to have more coming up tonight, but the greatest number of Pennsylvanians who have lost coverage aren't the very lowest income people. They're people between 150% and 200% of the federal poverty level. So people are earning up to about twice what the federal poverty level would categorize as impoverished. So these are the people who have really been hit by the expiration of those subsidies.
Absolutely. All right. Good information. Seth Kaplan, live in the ABC 27 newsroom. Thank you so much for that.
Hi, I'm Eric Finkenbinder from ABC 27, and we're excited to announce the new ABC 27 News Plus app. Live stream newscasts or watch content on demand. This is different than the ABC 27 app on your smartphone. You can check this out at home, and it's very easy to use. With a Fire Stick, go to the homepage, scroll down to search. From there, enter ABC 27. Move over to the apps, and there we are. Click the icon and install. It's just that easy.